Hi there, everyone. My name is Michael Montess, and I'm a postdoctoral fellow at the University of Victoria. My presentation today is Learning from BC's HIV Oral History, Community-Based Responses to HIV/AIDS and Other Contemporary Health Crises. So as we're seeing with COVID-19 today, the history of HIV/AIDS foregrounds the summit theme of disruption and reconstruction. Gay, bi, trans, two-spirit, and queer, or GBT2Q, individuals and communities developed community-based supports and challenged social inequities through activism during the AIDS epidemic. Although GBT2Q communities cared for each other and resisted social inequities through direct action activism, treatment advocacy, and the creation of community care networks, all of which remain important today, these community responses were also often complicated by the fact that some further marginalized communities were initially excluded, even though they were disproportionately affected by HIV/AIDS. And this is something to really be aware of as we continue to deal with COVID-19 and other public health crises. So there are really two main points in this presentation. One, that community responses are crucial during public health crises. And two, that we have to be aware of how some marginalized communities are often ignored in those community responses. In order to highlight this, I'll draw on the data from the community-based HIV In My Day oral history project. HIV In My Day has so far collected 116 interviews with long-term HIV/AIDS survivors and caregivers conducted by their peers from 2017 to 2020, focusing on the early years of the AIDS epidemic. Prior to this project, little work had been done in BC to collect stories from community members about the early years of HIV/AIDS, so this project aims to address this gap by doing three things. One, preserve this essential community history. Two, generate intergenerational dialogue about the meanings of HIV/AIDS. And three, revitalize ongoing treatment and prevention efforts in the present. One way that we are preserving this history is in a publicly accessible digital archive at the University of Victoria libraries. And you can check out this link if you'd like to explore that more yourselves. In discussing the initial findings of the project, I'm going to be focusing on the following themes, which not only demonstrate how GBT2Q communities cared for each other and resisted social inequities, but also how these responses often excluded certain groups. Many participants were engaged in HIV/AIDS activism and advocacy in the early years of the AIDS epidemic. Because of the stigma, discrimination, and isolation they faced from governments, healthcare institutions, and society more broadly. This activism involved groups like ACT UP Vancouver. Participants also importantly noted that much of this early HIV/AIDS activism built on previous forms of gay activism. This quote discusses ACT UP in more detail. Quote, ACT UP was already existing and there was a lot of activism around, whether it be trying to do more research for clinical trials or trying to get more access to medication. So people that were involved in HIV/AIDS activism, it wasn't just a desk job. It was like, what are we going to do to shape the foundations of this world who's absolutely ignoring us and we're dying? So what are we going to do? Participants were not only involved in activism, but also in AIDS service organizations, ASOs, like AIDS Vancouver, BC Persons with AIDS, PWA Society, later Positive Living, AIDS Vancouver Island, and of course, many others. Participants explained that ASOs were very important for caregiving and support. In this quote, a participant explains a little more about ASOs. Quote, here in Vancouver and internationally, I think AIDS service organizations really came to the fore. They did a lot of work, and I think it was very successful. People knew what was going on. They understood, I think, that the idea of safer sex education and support for people with HIV, that was what they did. And I think they did a very good job. Many participants were also involved in caregiving for people living with HIV, whether it was formal caregiving as healthcare providers and volunteers, or more informal caregiving as partners and friends, or through ASOs. In this quote, a participant explains both formal and informal caregiving and how they could often overlap for community members. Quote, if you had a partner who was dying of HIV, is that the formal or the informal? You were the caregiver. And if you were working in the hospital, it's true. But if you were part of the community, it's just a continuum of care. So I took care of people who were dying of HIV when I was at work, and I took care of them when I wasn't at work. In terms of the gay community, participants explained that it was really the epicenter of the epidemic in the early years of HIV/AIDS. Although homophobia contributed to very slow medical responses, the gay community bonded together and built strong HIV/AIDS activism, ASOs, and networks of community care. In this quote, a participant explains the importance of solidarity in the gay community. Quote, But the gay community rallied. There was such a solidarity that they were just an example of how you move governments, how you move public health, how you move systems. And I think it was because they were motivated, educated, and had a kinship with each other that they needed to be together on this. And lucky for public health, because the gay community moved things along much faster than we would have. However, it wasn't only the gay community that was disproportionately affected by HIV/AIDS. It was also the Indigenous community, women, people who use injection drugs, people with blood disorders like hemophilia, and the African, Caribbean, and Black community, among others. Each of these communities had different needs and experiences, and they didn't all have access to the same resources and organizations that the gay community had at the time. One participant explains the challenges of meeting the needs of different communities. Quote, the downtown East Side didn't get involved until a little later, and then there was poverty involved in the HIV component, and that made a big difference. And then there was a huge split in the resources of the community and a lot of problems about how do you service the community and still service that community? How do you service men? How do you service women? How do you service Indigenous people? All of these problems came up almost all at once. In terms of the Indigenous community, Indigenous people faced intersecting issues like poverty, racism, settler colonialism, and substance use, which affected their access to ASOs and healthcare in terms of HIV/AIDS. So participants developed their own ASOs, like Healing Our Spirit, and others to serve the specific needs of the Indigenous community. In this quote, a participant explains the impact of HIV/AIDS in the Indigenous community, highlighting networks of community care and solidarity. Quote, in the Indigenous community, it eventually entered our community. And with our friends, that's where we decided to start taking care of people who we had become friends with. And we would do impromptu care teams. So we would take turns of being with an individual on their journey to the spirit world. The quote continues, quote, and so there was a large number of us to do it. And one of the things I want to say is it was the two spirit guys, the gay men, who came together to help do the caregiving. But the next group to come along to help were the women, and in particular, the two spirit women, because they were their friends too. In terms of women, they were involved during the early years of the AIDS epidemic in BC as caregivers, especially two spirit women and lesbians, but they were also affected by HIV/AIDS directly. Women living with HIV faced unique challenges because of HIV stigma and discrimination, and the fact that many resources were targeted to LGBTQ men at the time. Therefore, participants explained that they helped create ASOs like Positive Women's Network and others that specifically focused on women's needs. One participant explains some of those specific needs. Quote, but I mean, I think when it comes to women, we're just so diverse that it's not as neat as saying you have a gay men's clinic and you know who your audience is. You know who you're serving. You can delineate some of your terms of reference and what their needs are. But with women, you've got so many different defining factors. Do you live in a city? Do you live in a rural area? Are you married? Are you single? Do you have children? What's your family situation? So what are the lessons we can learn from this history going forward with responding to health crises like HIV/AIDS, COVID-19, and others? Well, one participant explains that we should learn from our previous experiences in terms of the opioid epidemic. Quote, I look at that epidemic and I think, why is it even happening? We've already been through this. Another participant explains that solidarity is crucial in our responses. Quote, even if we have differences, we work together. It is possible to change minds or inform people who have misconceptions that contribute to hostile responses to people in need. Overall, the strategies highlighted in the initial HIV In My findings for resisting social inequities and creating community care networks remain important today, not only for ongoing community responses to HIV/AIDS, but also community responses to COVID-19, future pandemics, and other contemporary health crises. This history highlights how LGBTQ communities have resisted inequalities for decades, despite persistent disparities in access to HIV treatment and prevention, and it also serves as a timely reminder of the necessity of ensuring that communities experiencing intersecting forms of marginalization and oppression aren't left behind as we continue to build community-based responses to all of these crises. I want to take a moment to acknowledge and thank our broader research team for their many contributions to this project. I also want to thank our partners and funders. Thank you for listening to my presentation today, and please reach out to me if you are interested in our project or if you have any questions. Thank you.